I'm Autumn Lockett,
And this is Mitch Randall.
and you're listening to Good Faith Weekly.
This week on Good Faith Weekly, we're going to be talking about COVID-19. It is spreading across the globe, and here in the United States, there is a lot of panic, but also a lot of good and bad information being spread across the country. We're going to be talking about it in our first segment, and then in our second segment, we are very fortunate to have with us Dr. Kevin Heifner, nephrologist out of Little Rock, Arkansas. One of the things that has really been eye-opening to me has been the slowness, I should say, of the larger community's embracing of this crisis. It seemed to be, what's going on? Could it really be this bad? To add up, people saying it's a hoax in some circles. To now, it seems over the last 48 hours, everybody understanding this is deadly serious. Mm-hmm. And one of the things that comes to mind, Autumn, as I have traveled around the world, and when I was pastoring at North Haven Church in Norman, Oklahoma, we would take numerous trips over to Ghana, West Africa, to hand out insecticide-treated mosquito nets to combat malaria. And that, I'm not trying to equate the two, but when you talk to Ghanaians and anybody in an environment where public health is always on their mind, potential death from a mosquito bite or from flu-like symptoms because of just the spread of disease and how quickly it can escalate in places like Ghana. There's this mindset of always trying to be careful, and there's this attitude of cleanliness and hygiene, vigilance, absolutely.
Yeah.
Here in America, we really, the blessing of living in a country like this can also be a curse, mm-hmm. because we have never faced anything like this before.
No.
So we were unprepared to accept the reality of what this virus could potentially do. And so I think that may play a little bit of a part in this dissemination of taking this pandemic seriously, because we've never faced anything like this, and we're not used to quarantine ourselves inside of a house.
Right. Well, and I think this goes back to a broader topic that we've discussed, at Good Faith Media now for a while, because we're such an ancient organization.
Oh, yeah. Right.
But it's this concept of the other. We think, this is something that China's going to deal with, or this is something that Italy's going to deal with, or maybe in South America we'll have to, reinforce our borders there. And guess what? The virus, just like God, doesn't pay any attention to who the other is.
Mm-hmm.
And it's really removed some borders, and it's transcending, and it's making us not just walk around in someone else's shoes, but live in the same fear and vulnerability that some folks have to deal with, like you're talking about in Ghana. That's their reality, and all of a sudden it's on our shores, and there's nothing we can do about it. I mean, there's things we could do about it, but there's no stopping it. Like, I know we're going to hear from Dr. Kevin Heifner here in a bit.
Yeah.
And, there's not a vaccine for this yet. There's not any kind of treatment. All we can do is prevent it.
You're absolutely right. And, one of the things that, just trying to come to grips with the slowness of us being prepared and reacting to this virus, Americans have always suffered from manifest destiny, that somehow in the end, God is always going to protect us, and we're going to triumph just because we are who we are.
We've suffered and we've succeeded through it, right?
Yeah, well, yeah.
I'm a Texan, Mitch. Come on.
Oh, well, that's true.
Superlatives.
But this idea of invincibility, that it's not going to happen to me, that's the kind of things, these viruses happen to other people in other places of the world. We used to say that about terrorism, and then 9/11 happened.
Yeah.
Oklahoma City happened.
Yeah.
And terrorism was at our doorstep. now the kind of diseases that the global community has been experiencing for decades upon centuries is now on our shores.
Yeah.
And we're coming to grips with the fact that we are part of and we've used this term quite often at Good Faith Media, this global symbiotic ecosystem that is so fragile. And this is why being a part of a global community matters. This is why coalitions matter. This is why treating our brothers and sisters on the other side of the world with decency, with respect, and compassion matters.
Yeah.
Because we are all living on one planet, and we are all residents of this planet. And these diseases that we're seeing, such as COVID-19, are going to continue to evolve and become more aggressive. And we need the global community to stand beside us, and we need to stand by the global community because this is not the last time we're going to see a disease like this.
No, or a disease like racism, or a disease like apathy, or a disease, of isolationism and individualism. Like we don't have that benefit. Like we can't. We have, like you're talking about, we have a responsibility to our neighbors, whether that's across the street or around the world. And I think really having this platform and continuing to tell our more to tell is so important.
Yeah. One thing I do want to talk about, changing gears, we've been talking about a lot of these issues from a 30,000 foot viewpoint. But let's get down on the ground a little bit. Just so our listeners know, we're not in a studio today. We are recording this podcast over Zoom. I am in my office in my house.
And I'm in my closet.
And Autumn is in her closet. I didn't want to out you.
No, it's fine. I may do a screen grab so people can see, the difference of you with your grown children, coming to the house, and me with my 4 super not grown children roaming the house.
Yeah. Well, let's talk about that a little bit. I mean, because this is real life, and this has been a disruption like we've never seen before.
Yeah.
And I'll just tell my story real quickly, and then talk about what's going on over at your house. Missy and I have been empty nesters now for the total of about 5 months. We've got one son who's out in Los Angeles finishing up his senior year at Emerson College. Our youngest son is at Dartmouth in New Hampshire. And so we had both of our boys on polar opposite sides of the country. And we got news quickly that Dartmouth was going to move to online classes starting immediately after spring break. And so it was pretty natural for us to bring our youngest son home. And he's going to be staying here, but he's going to be starting class here in a couple of weeks after spring break's finished. But he's got to do it remotely here at the house. And so he's now back living with us. We were really frightened because Emerson decided to close campus at their Boston location and now their LA location. And my oldest was told Friday that he had 1 week to leave the premises. Well, I don't know if you've seen a map or not, but LA's quite a long ways away from Norman, Oklahoma.
Yeah.
So we were trying to figure out what to do because he was wanting to actually stay out there and he had to leave on an apartment. But then all of a sudden the news out of San Francisco, was broken about, basically keeping everybody in quarantine there. And then New York City. He had potential of being homeless for 2 weeks is what we're trying to say. So we quickly got him on a flight, and he's not even here yet. He's going to arrive tonight. So we have the potential of having all 4 of our family members under one roof, which hasn't happened in 4 years, which as a dad and mom, is nice. We hate the circumstances in which it's happening, but all this logistics that's taking place, trying to keep our family safe has been really a logistical gymnastics for us. And kudos to my wife for getting all this together for us, but she's done a marvelous job. So that's our story. What's your story?
Yeah. Well, I think we all kind of approach this. I know my immediate concern as a former classroom teacher is always for those children who, rely on school for meals, who, whose parents work hourly jobs, and what are they going to do? And so as we started thinking about our children on spring break this week, so we were already planning to have them home. But I already was trying to, work with our local PTA about what lunch handout was going to look like if they ended up canceling school, which now they have through April 6th. So I'll be at home with our 4 young kiddos until at least April 6th. And then out of nowhere on Friday, my husband lost his job.
Oh, yeah.
He's not an hourly employee. He's an attorney, and he's at a small firm, and they had a lot in the stock market, and then suddenly they didn't, and he was the last one in. And so all of a sudden, yes, I'm still concerned about those babies, at school, and we're going to do everything we can, but thankfully we're in a position where we're going to be okay. But I think this is going to continue to hit families, even families who don't realize that we never expected to have something like that happen to us. And it's really just exacerbated the stress level, to be honest with you. And I keep asking myself, is this an anxiety attack or is this corona? I think it's anxiety. And
it might be a little bit of both. Yeah,
no fever, so I'm good. But yeah, I mean, at the expense of getting, TMI, that's where our family is. And, if you're out there and you're, living in fear that this is going to happen, the sun's going to come up tomorrow and we're all going to be in this boat together.
And that's an excellent word, because, we are in a dire situation right now. And I just cannot imagine what some of our laborers, our small businesses who, depend on that weekly paycheck to make things happen and pay the bills.
Yeah.
But what we're seeing, and I hope we see more and more of this, is an incredible spirit of compassion and understanding and a coming together. This is when people of faith, this is when America is at its best.
Yeah.
When we are faced with tremendous strain. And I think we will continue to see that, because this is not only going to change our lives for the near future, it is going to change the trajectory of people's life for a long time. And we need to, as a people of faith, remember that and be kind and be compassionate and treat your neighbor as Jesus so rightly told us to do long ago, as we would treat ourselves, and to love them like we've never loved them before. And so that is an important word to hear, because families and individuals are under great strain right now and anxiety. Yeah. Well, coming up next, we are going to be joined on the phone by Dr. Kevin Heifner. Dr. Heifner is a nephrologist out of Little Rock, Arkansas. Also happens to be the chairman of the board at ethicsdaily.com, a person of faith, and we're really excited to talk to him in the next few moments.
And just an all-around super fun guy. We love Kevin.
Absolutely. We'll laugh a lot, I promise.
Perfect. We're looking forward to it.
Welcome back to Good Faith Weekly. And we have a very special guest with us this week, as the coronavirus, COVID-19, continues to spread globally around the world. We are very fortunate to have Dr. Kevin Heifner with us today. Kevin is a nephrologist out of Little Rock, Arkansas, and also happens to be the chairman of the board at Ethics Daily. So, Kevin, welcome to the podcast today.
Mitch, I really appreciate you guys asking me to participate, and I hope that I can give a couple of words that may help your listeners as we all kind of get through this together.
We appreciate it, Dr. Heifner. Let's just begin with the seriousness of this crisis that we're facing. It seems like this pandemic, as the WHO has already declared it globally, is continuing to worsen. In some places, it is getting a little bit better, but places like Europe and here in the United States, it seems to be progressing extensively. Can you just, tell us how serious this is?
Yeah, let me start by saying a couple of things, or telling you a couple of things about myself, because I want, in full disclosure, people to understand. But I think I can pivot off that and make a really important point.
Yeah, go ahead.
Mitch, I'm a kidney doctor that lives in Little Rock, Arkansas, that works for 12 years. Everybody needs to hear, I am not an expert in infectious diseases or the coronavirus or anything along that. But I think that's really what's important for people to hear is that I'm not an expert, and that your listening population does not need to be an expert either. I may actually know a thumbnail more than you do, and we probably both watch the same updates every evening on our local news.
Mm-hmm.
Your question specifically, as I was talking to friends and colleagues within the past 10 to 14 days, I may have been a little bit more attuned to this just because I am a physician. And I would, let me give you this one thought. The people that are the most well qualified, the people that know the most about what this is, what it could be, and where it could go.
Are they the politicians?
Amazingly, it's not.
What? They're the loudest.
This was unscripted. Let me just say thanks for pivot point number 2, because but and without being partisan in any way. I mean this is really important. So let me just make a couple of quick points. I'm a trained physician. I have a background in science. I have a bachelor's degree in chemistry. And I'm not a research scientist. I'm a guy that lives in the community like most of your listeners. You know, I'm not an ivory tower guy. That being said, I can tell you, I was taught to think logically. I was taught to think objectively. Scientists, by and large, are data driven. And so things like your preference or your opinion really doesn't enter into the standard way that most good scientists think. And the good news is we don't have just good scientists out there that are readily available to us all. We have some really great scientists. And to get to this point, here's the thing. Really good scientists, they speak differently than most of us. They speak very precisely. They choose their words very precisely. They only say the things they intend to say. Now, a week, 2 weeks, I'm not exactly sure when the WHO began describing this as a pandemic, a term that was picked up very quickly by people like Dr. Anthony Fauci of the NIH. And when real scientists use words like pandemic, trust me, they have done their research. They do not get out in front of that term. They know full well the potential of how bad this could be. That is a really not even a generational word. That's every couple of generational words for a real scientist to use. They do not throw that word around.
Yeah. So what you're saying, Kevin, is that this is deadly serious, and anybody who's not only listening to the pod but getting their news and information from whatever outlet that they listen to, they need to heed this warning seriously and adhere to the restrictions and the cautionary behaviors that the CDC and organizations like WHO are putting out.
Absolutely. I'm 54 years old. I cannot remember a more serious public health concern in my lifetime. And it's that serious. So, and just real quickly, you know, a week ago, I felt like we were still really having to hammer home that point. But I do think even in the past 2, 3, 4 days, society has very quickly auto-corrected poor thought that allows people to say, well, this is overblown. Mm-hmm. This is area. Look, here's what I tell people. Look, this isn't partisan. This doesn't care party. This doesn't care if you're a person of any faith. This is biology. Hard stop. It is public health. Hard stop. And it's simply a matter of numbers. And this is how viruses replicate. It's just math at the end of the day. So it's not like you get a choice to choose whether you want to believe it or not. The reality of this situation is what it is. So I would encourage everybody to take it very seriously.
Well, that's
so
good
here's,
to know.
Here's my question. So, you know, I know when I watch movies like Jaws, it's a scary movie. If you're sitting in the right. If you're sitting in the ocean, it's a really scary movie. With me, with my feet on dry land, it's a fun thing to watch in the summer while I eat some popcorn. So in every horror movie, we talk to the people who are in the movie and we say, don't go in there, don't do those things. Like, what are you doing? So at the same time, you say, hard stop, this is biology, this is public health. But if you just stay home and hunker down and practice social distancing, more likely than not, you're going to be okay. So why is that so difficult?
Well, that's a great question, but to the most important point, and then I'll try to give you a why, because the why, that's conjecture to some degree.
Sure.
The hard science is this. Okay, one, there is no treatment for this. So, we can't give you a pill and make you better. So what is the treatment, as it were? The treatment is don't get infected in the first place.
Yeah.
So if there were one piece of information, and only one, that everybody needs to hear and adhere to, it is this: social distancing is the best preventative and, in a sense, the best cure, since we don't have a medicine or a procedure. In fact, it's one of the ones that I would say is one of the only ones. Social distancing, human beings need to stop congregating in groups. Okay. Mm-hmm. Now, a group could be what? A group could be church on Sunday. A group could be your quilting class on Tuesday night. Unfortunately, I saw a group 2 nights ago, because Disney World was shutting down for the last time. Well, humans being who we are, we thought the people that had paid money to be in the general vicinity of Disneyland thought, well, I'm going to go to Disneyland one last time and get my money's worth. There were 3,000 people there. I saw a picture today. Now, I did not document, and I'd really try to document everything I say. I did see a picture today of, quote, spring break at one of the Florida beaches, packed.
Saw that. I saw the same thing.
Teenager. At some point, we just have to keep repeating. The only thing we can do is not congregate in groups. And then you go, well, you can wash your hands, sure, and you can,
Kevin, along those lines, because the federal government and state and local governments are now declaring not only states of emergency, but are enacting curfews, limiting meetings of more than 25, in some cases 10, putting mandatory quarantines on large blocks of cities such as San Francisco. At this point in time, New York City, I think, is contemplating that as well. I think they've done that in New Rochelle. But with the government all up and down the line, from local to federal government, taking this into consideration, and a potential national shutdown that looks like we're heading towards, what kind of time frame are scientists saying that a shutdown would last to flatten the curve? We've heard Dr. Fauci talk a lot about flattening that curve. And so how long would it take for that to occur?
That is a really good question. That's actually a pretty hardcore science question. And rather than get into specific details, because I simply don't know, in all honesty, I've seen the curves you've seen. I've seen them many different ways. The one that goes straight up and straight down, the spike, that's bad. Right. The one more like a slow dome, that's good. Now, as to the specifics, and again, okay, here's another really important point. I'm going to try to give your listeners 2 or 3 take-home points. One has been, we must practice social distancing. Mm-hmm. That 2 is look, the rate at which the information about this is changing is unbelievably fast, even for trained virologists and trained epidemiologists, people that really are expert. So, it changes from day to day. So for a community-based kidney doctor to try to tell you some really specific, here's the point. Don't depend on me. Don't depend on your internet.
That's a good word.
Don't depend on Facebook. I keep repeating, listen to the experts. Dr. Anthony Fauci, the NIH. And I did this too, because before we talked, I thought, I don't even know what's happened today. So I called a couple of people more expert than me. And one guy said, I gave a talk 2 days ago at my church in Little Rock. This is an infectious disease specialist. Mm-hmm. It's already changed so much. I'm not even updated. And he just gave a talk 2 days ago. Now, he said, Kevin, and I said, yeah, I get it. This is what I've been telling people too. He said, we need to quit trying to spread the science. He said, we need to get laser focused. Get your science from a reputable source. Let me give you one or two.
Mm-hmm.
Coronavirus.gov. I just went to the website 20 minutes ago.
Okay.
It's going to have the absolute most up-to-date, science, but science written for the general public. What do I do if I think I'm sick? What do I do if I'm a fever? Can I go visit my elderly mother in a nursing home? And it's I just looked at the site for the first time. It's very manageable. You don't need to depend on me or anybody else in your local community for those kind of details. Go look at that website every day. Another one, cdc.gov, which I think they those two websites actually kind of meld looking at them, but at least that's believable information.
Mm-hmm. Right. Yeah, absolutely.
Get your information there. Get it from Dr. Anthony Fauci, who gives every single day a daily update. Dr. Fauci is a human. I'm sure he has imperfections, but he is a national treasure. I've been a physician for 30 years, and I've known of him my entire time in medicine. If it comes out of his mouth, I would believe it. Autumn, to circle back to your point earlier, I'm trying to talk quickly because I know we got a lot, but to circle back specifically to your point, this has nothing to do with partisanship, but in general, your crack or comment about the politicians, you're right. Don't listen to them. I mean, if they say something that's like the government's recommending don't get in groups of 10, okay, that's fine. That's general. Sure. But get the real information from the scientists and physicians. I am pounding this point home, and I've given 2 reputable websites.
Right, and that's great. Yeah, I mean, that is excellent advice. Make certain you do check out those 2 websites. We've got 2 more questions for you, Kevin, before we let you go, because we know you got a busy schedule today. I'm going to ask the first one, and then Autumn's got an ending question for you. My question is, you're a physician. We see these hospitals, especially in hard-hit areas like Seattle, New York City, globally, Italy, they are working 24/7, sleeping at the hospitals, physicians, nurses, staff. What can people of faith do to help support our medical staff who are under tremendous pressure, not only now, but it seems like for, quite a bit of future here?
That's really a great question. I haven't really thought about that. Let me say a couple of things. One is a piece of information I just saw within the past hour. Again, literally how quickly things change. And again, I have not documented this, but I saw that 9 physicians at an Atlanta, Georgia hospital have now been diagnosed as of today.
Wow.
That's 9 physicians. Now, real quickly though, I think it's so important. I want to really make this point because I've seen a lot of interesting, way to go nurses, way to go doctors. Mm-hmm. There's probably more people that work in a hospital that are patient care techs, mm-hmm. that are dialysis techs, that are a custodial service, and they provide as important a function as we do. And here's the reality. They are in much closer personal contact with human beings than I am. I'm a physician. I walk in a room, spend 2 minutes, I turn around and walk out, and somebody else goes in there and bathes that person and cleans their secretion. So it is, please, let's everybody out there understand, it's not just doctors and nurses.
That's a great reminder.
Everybody. So what can you do? I think if these people go to your church, give them a pat on the back, tell them you appreciate what they're doing. Obviously, keep them.
Don't pat them on the back. Tell them 5 feet away, hey, you're doing a great job. Give them a thumbs up.
Give them a thumbs up on Facebook. That's right.
hey, to be in full disclosure, that was a test for you too.
Woo, thank you. Wow, pop quiz.
But look, if the guy down the street, he's worked a 12-hour shift.
Sure.
And you're out buying milk, call his wife and say, hey, I'm going to the store. Can I get you some milk and bread? You don't have to get out.
Right.
Really. And just be aware of people in your life and in your community.
Yeah,
that's
a good word.
Yeah.
So, Autumn, you've got the last question.
Yeah, Kevin, we end our podcast interviews each week with, our good faith media motto is "There's more to tell," and so we like to ask our guest, "What is your more to tell? What do you want our audience? What do you want to leave us with?"
Well, now you talk about a setup question. Okay, let me make one statement, and then I'm going to tell you what there's more to tell. To refocus for the third time on the one point, which is get good information and do it. A friend of mine told me a month ago, not about this, about another medical matter, and I asked him a question, and he goes, "Well, where did you get that culture?" And I said, "Well, I don't know. The nurse, I wasn't sure." And he looked at me. He's an older doctor than me, and he said something. It was so wise. He said, "You know what I always say?" He kind of griped at me. I said, "Yeah, I know what you say." I said, "Go ahead and say it." And he said this. He said, "Always remember, no information is a better thing than bad information." So when we get bad information disseminated from websites or friends or buddies, I would almost rather be totally ignorant, because if you give me bad information, I'm going to make bad choices. If you give me no information, at least I probably do no harm. I just sit there and go, I don't know anything. I twiddle my thumbs. Just remember the source of your information. Now, there is more to tell. If there's been a thing that's come down the pike in a while that there's more to tell than Corona, I don't know what it is. Medically, I saw I think a reputable set of numbers that showed in the past 4 days, and it was either in, I don't know, one of the major southern cities, the deaths had gone 1, 2, 4, 8, and like 24 in 5 days. So, well, there's more to tell. None of us know the outcome of this. We clearly know it is a viral process with almost predictable math. I mean, we know things are going to get worse. Now, the more to tell. Okay, those are numbers, but the more to tell is the human spirit, the human acumen. We're not going to be beaten by this. And that's the more to tell, is how are we going to see humanity come together across borders, across state borders, across national borders, and act as a world community to help, keep this thing in check and ultimately beat it. That, to me, is going to be the really fascinating part of this story, and there's clearly more to tell on that.
Well, I hope you're absolutely right. That is a good way to end our interview today. Kevin, thank you so much for joining us. Thank you to all of our physicians, nurses, attendants, medical workers in the field. You're doing a spectacular job. We need to continue to keep our first responders in our prayers as well. Lots going on in our world today. As Dr. Heifner reiterated time and time again, get good information and act on it, people. Act on that good information. And let's get this thing in our rearview mirror. So I'm Mitch Randall, and Autumn?
I'm Autumn Lockett, and we appreciate Dr. Kevin Heifner being on our call today.